In this video, we'll be discussing the results of a quick study on cultivation theory as it relates to Gray's Anatomy. And so we talked about in the last video this history of how doctors have been portrayed. And so even as doctors start to be portrayed in more, or in a way that focuses more on their struggles, their difficulties of being a doctor, the coverage remains very positive. And so a show like Grey's Anatomy does still show a lot of the positives and negatives of being a doctor, which is consistent with other portrayals on TV. But one of the things that starts to be a focus is, again, on the courageousness of the doctors, that they are making critical decisions in the moment to determine the fate of their patients. It's just supplemented by more of an interest in this daily life struggles of what it's like to be a doctor around making those decisions. And so to look at this, he talked to about 200 or so people ranging from about 18 to 46. Most of them were white, and vast majority of them were women. He found that majority of them had watched at least some episodes of Grey's Anatomy. 78 or so had watched all the episodes that were available at that time, and only about 95 hadn't watched the show at all. And so they were asked about whether or not they found the show credible. You need to think the show is credible in its portrayal of doctors to kind of be able to see how you're going to be approaching the show, how they perceive the show's representation of the doctor's courageousness, and how much satisfaction they had in their interactions with their doctors. So when we look at how the show portrays courageousness, they did find that the number of episodes watched was associated with perceived credibility of the show. So the more you watched the show, the more you saw its portrayal of doctors as credible. And there was a positive correlation found between the show's portrayal of there was a positive correlation between perceptions of the show's credibility and real-world doctor courageousness. What this means is that for people who saw this show as credible, that this was an accurate representation of what it's like to be a doctor, those people then went on to also see doctors in the real world as also courageous, because that's how doctors are portrayed on TV. And this would fit into the expectations of cultivation theory, that if what you're seeing on TV is that doctors are courageous, they're always willing to take chances and do everything they have to and make the critical decisions in the moment that's going to save their patient's life, that is going to be the dominant way you see doctors in the real world. And so the way doctors are portrayed in TV is the way you see doctors in your social life. There was no direct effect found between heavy viewing of the show and any of the perceptions of doctors, so they didn't find any evidence, at least for this one show, that just watching a lot of it affected how you perceived the doctors based on the show. But they did find an indirect effect for heavy viewers who also found the show credible. So if you find the show to be credible and you watch it a lot, then that's where you start to see the effect. But it needs that mitigating variable of finding the show credible. You can watch it a lot, you can watch every episode, but if you don't find it to be credible, then it's not going to shape your views of doctors. So you might watch the show, for example, just because all your friends do, and so every Thursday night you all sit down and watch it together, but you might think it's the silliest thing you've ever seen. And so just because you're a heavy viewer of it if you don't find it realistic, if you don't find it credible, you're not going to be influenced. And they also found a strong association between doctor courageousness and patient satisfaction. And so if we perceive doctors being courageous, that they're willing to take risk and make those critical decisions, then we're more likely to be satisfied with our experiences with doctors in our own lives. And that, again, so you work from there. You see doctors as more credible and more courageous because of what you see on TV, and that then leads you to see doctors in the real world as more credible and courageous, and that then leads to you being more satisfied with your experiences with your own doctors. And again, it needs that intervening variable of perceiving the show as credible, that the show can't manufacture that. If you don't view it as realistic, if you look at it and go, this is silly, then you're not going to be influenced. But there is still an effect happening just from that continued exposure to the show over a long period. So they did show some ability to apply cultivation theory to a singular program, especially if it's more long running, but there is a need for, or there's that fact that it is an indirect effect, not a direct one. So again, there was some perception of the show as shaping how we see doctors in terms of their courageousness, which then leads to our greater satisfaction with, as patients. And so the idea that cultivation theory is happening, that the cultivation effect is occurring just because you watch this show a lot and it shapes how you feel about doctors, is supported in this study.